Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. A nurse is transferring a patient with chest tube drainage on an X-ray department for chest X-ray. Which location should the nurse place chest tube drainage at? A. Directly on the stretcher in an upright position. B. On the side of stretcher next to patient. C. Hanged on 4-pole that is attached to the stretcher. D. Attached to the stretcher and hanged below a mattress. The answer is option D, attached to the stretcher and hanged below a mattress. 2. A nurse is caring for a patient diagnosed with pancreatitis. An abdominal X-ray reveals evidence of signs of biliary disease. What would the nurse most likely instruct the patient? Consume a high-protein diet. B. Gradually increase dietary fiber. C. Avoid ingestion of alcoholic beverages. D. Limit activities when the patient is fatigued. The answer is option C. Avoid ingestion of alcoholic beverages. 3. Which of the following patients the nurse should see first? A. Patient complaining of muscle aches and fever. B. Patient scheduled for electrocardiography. C. Patient newly diagnosed with hypertension. D. Patient with complaints of chest pain. The answer is option D, patient with complaints of chest pain. 4. A 5-year-old child was admitted with nephrotic syndrome. A nurse noticed that the child has slight facial puffiness with mild pitting edema on his hands and feet, and there was no distended abdomen. Which type of diet the nurse should order for the child? A. High protein, high salt diet. B. Low protein, low fiber diet. C. Low protein, normal salt diet. D. Normal protein, low salt diet. The answer is option D. Normal protein, low salt diet. 5. What must be known on legal points of delegation when processed to a new nurse? Evaluation of performance of delegate by client. B. Actual time it takes to complete the task by delegatee. C. Institution definition of the job description of the nurse. D. Number of times that the delegatee has done the task previously. The answer is option C, institution definition of the job description of the nurse. 6. An Indian patient, who is vegetarian, is being discharged from the hospital after an elective surgical procedure. The unit nurse is teaching using visual aids and pictures about food combinations containing complete protein. Which of the following food items should the nurse recommend? Dietary list of the patient? Lentils. B. Potatoes. C. Macaroni. D. Green salad. The answer is option A, lentils. 7. The physician has ordered mannitol for a client with a head injury. What should the nurse closely monitor because the client is receiving mannitol? A. Deep tendon reflexes. B. Urine output. C. Level of orientation. D. Pulse rate. The answer is option B, urine output. 8. An adolescent with a juvenile diabetes mellitus develops renal failure. Which of the following diets is suitable for this client? A. Low fat, B. Low mineral, C. Low protein, D. Low carbohydrate. The answer is option C. Low protein. 9. A woman presented to the clinic with painful urination and green-colored vaginal discharge with foul odor. The nurse should suspect A. Syphilis, B. Trichomonas vaginalis, C. Gonorrhea, D. Chlamydia. The answer is option B. Trichomonas vaginalis. 10. A 65-year-old woman presented to her care provider with complaints of bright red blood in the stool, a loss of appetite, a feeling of fullness and fatigue. She had lost 5 kilograms in the past 3 weeks without dieting. A fecal occult blood test is positive and the patient is scheduled for additional screening test. Which screening test is most likely for this patient? A. Barium enema, B. Colonoscopy, C. CT scan, D. ERCP. The answer is option B. Colonoscopy. 11. A 12-year-old child has been diagnosed with diabetes insipidus. Which of the following is disorder? A. Posterior pituitary, B. Adrenal medulla, C. Anterior pituitary, D. Adrenal cortex. The answer is option A. Posterior pituitary. 12. During a night shift, a medical doctor complains of back pain and asks the nurse to give him morphine 5 mg IM. Which of the following actions indicates professionalism in handling the situation by the nurse? A. Call another doctor to manage. B. Refer him to emergency room. C. Administer morphine to doctor. D. Ask him to write a prescription first. The answer is option B. Refer him to emergency room. 13. Nurse manager assigns work according the nursing competency. This is called as A. Delegation, B. Planning, C. Controlling, D. Multitasking. The answer is option A. Delegation. 14. A 3-year-old child with an elevated body temperature is administered with oral aspirin. The nurse records the body temperature of the child after 2 hours and finds that it is still elevated. What is the most likely underlying physiology for the delayed response in action of the aspirin? A. High gastric pH, B. Thin epidermis, C. Low muscle tone, D. Short intestines. The answer is option high gastric pH. 15. Which of the following is described as premature separation of a normally implanted placenta during the second half of pregnancy, usually with severe hemorrhage? A. Placenta previa, B. Ectopic pregnancy, C. Incompetent cervix, D. Abruptio placentae. The answer is option D. Abruptio placentae. 16. A year-old man is undergoing preoperative preparation for a procedure in which the physician will visualize the large and distal part of the small bowel with a camera attached to the flexible tube. Which of the following positions is the most appropriate? Left Sims, B. Right lateral recumbent, C. Trendelenburg, D. Prone. The answer is option A, left Sims. 17. A laboring client is in the first stage of labor and has progressed 6 centimeters in cervical dilation. In which of the following phases of the first stage does cervical dilation occur most rapidly? A. Preparatory phase, B. Latent phase, C. Active phase, D. Transition phase. The answer is option C, active phase. 18. Which of the following ECG findings indicates MI? A. ST depression, B. ST elevation, C. Short saint, D. None of the above. The answer is option B, ST elevation. 19. AMU care nurse instructing a mother of child diagnosed with cystic fibrosis about the appropriate dietary measures. Which diet should the nurse tell the mother that the child needs to consume? A. Low-calorie, low-fat diet, B. High-calorie, restricted fat, C. Low-calorie, low-protein diet, D. High-calorie, high-protein diet. The answer is option D, high-calorie, high-protein diet. 20. Which of the following patients the nurse should see first? A. Patient complaining of muscle aches and fever, B. Patient scheduled for electrocardiography, C. Patient newly diagnosed with hypertension, D. Patient with complaints of chest pain. The answer is option D, patient with complaints of chest pain. 21. A nurse is preparing the room for a patient who will be admitted the post-anesthesia care unit after major abdominal surgery. The patient received general anesthesia care. Which of the following should the nurse place at the bedside in the room? Sterile suction catheter, B. Oral airway, C. Incentive spirometer, D. Face mask. The answer is option C, incentive spirometer. 22. The nurse is completing the preoperative checklist for one of the patients who is wearing a ring. What is the most appropriate action? A. Give ring to security office, B. Lock ring with patient's valuables, C. Call patient's family to give them the ring, D. Respect patient's choice and leave ring on patient's finger. The answer is option B, lock ring with patient's valuables. 23. A nurse is providing care to a patient with a new skin graft on the leg. The patient is upset and the nurse notes copious red drainage oozing around the dressing. The nurse should immediately lift the dressing to assess the area. B. Ask if the patient is having any pain. C. Apply firm pressure for 10 to 15 minutes. D. Assess the apical pulse. The answer is option C. Apply firm pressure for 10 to 15 minutes. 24. An adult client is admitted with a diagnosis of left-sided congestive heart failure, which assessment finding would most likely be present: A. Distended neck veins, B. dyspnea, C. Hepatomegaly, D. Pitting edema. The answer is option B, dyspnea. 25. The nurse who is caring for a patient with tuberculosis should wear A. N95 mask, B. Surgical mask, C. Cloth mask, D. No mask is required. The answer is option A, N95 mask. 26. A visiting family member informs the psychiatric nurse that another patient is being sexually inappropriate with other patients. The nurse tells the visitor to inform that patient's nurse. Which of the following describes the nurse's actions? A. Practical, B. Negligence, C. Organized, D. Delegation. The answer is option B, negligence. 27. Oman was restless and observed to have an increased physical activity after a heated argument with another person. After the assessment, the following data was gathered: agitated, diaphoretic, distorted. What is the patient's level of anxiety? A. Mild, B. Panic, C. Severe, D. Moderate. The answer is option C, severe. 28. Type of precaution for smallpox is A. Contact, B. Airborne, C. Strict, D. All the above. The answer is option B, airborne. 29. To decrease the anxiety of a 10-year-old girl who is undergoing surgery, which of the following should the nurse do? A. Use a heart model to show her how the surgery will go. B. Provide her with verbal explanation of the upcoming surgery. C. Give her a book to read about the surgery 2 weeks prior. D. Let her parents talk to her about the importance of having surgery. The answer is option A. Use a heart model to show her how the surgery will go. 30. The phase that include action of the nursing care plan is called A. Assessment, B. Diagnosis, C. Planning, D. Implementation. The answer is option D, implementation. 31. A client is admitted to the emergency room with renal calculi and is complaining of moderate to severe flank pain and nausea. The client's temperature is 37.8. The priority nursing goal for this client is A. Maintain fluid and electrolyte balance, B. Control nausea, C. Manage pain, D. Prevent urinary tract infection. The answer is option C, manage pain. 32. The surgical procedure that must be done within 24 hours is called A. Urgent surgery, B. Emergency surgery, C. Curative surgery, D. Palliative surgery. The answer is option A, urgent surgery. 33. The drug of choice for bradycardia is A. Adrenaline, B. Atropine, C. Calcium gluconate, D. Sodium bicarbonate. The answer is option B. Atropine. 34. A client has been newly diagnosed with hypothyroidism and will take levothyroxine 50 micrograms per day by mouth. As part of the teaching plan, the nurse emphasizes that this medication should be taken in the morning. B. May decrease the client's energy level. C. Must be stored in a dark container. D. Will decrease the client's heart rate. The answer is option A. Should be taken in the morning. 35. When a patient comes to ER after RTA exhibiting dyspnea, cyanosis, shortness of breath and tracheal deviation, we should suspect A. Hemothorax, B. Tension pneumothorax, C. Cardiomegaly, D. Pleural effusion. The answer is option B. Tension pneumothorax.
Thank you for watching.